It is an autosomal recessive disorder and it may have afflicted Julius Caesar and his family, since many of them had neuropsychiatric and dermatological features of this disease. This happens because of a mutation in SLC6A19 gene. This gene codes for a transport protein called sodium-dependent neutral amino acid cotransporter system B0. This transport protein, it is present in brush border of gut epithelium and renal epithelium. So there's a malabsorption of neutral amino acids at the level of gut, and there is poor reabsorption of the same at the level of kidneys. But it mainly affects only tryptophan because there are other alternative pathways of absorption and reabsorption for other neutral amino acids, and therefore it manifests with features of Pellagra. Any child who has typical features of Pellagra but no significant dietary history pertaining to the same, you should think about Hartnup's disease. In children, we won't have a typical depression, disorientation or delirium. We'd rather see apathy, irritability, anorexia and anxiety. Then the dermatitis of Pellagra, it has certain typical features. We all know that it affects the sun-exposed regions, and it can occur either suddenly or insidiously following an irritant exposure, which is usually sunlight. Initially, it appears just like a sunburn, symmetrical erythematous rashes on sun-exposed surface. But the typical feature is that it has sharp demarcation lines from the surrounding healthy tissue, giving it a collar-like appearance, which is also known as castle necklace. It has been named after a Spanish physician, Castle, and a similar finding in arms is known as glove and stalk pattern, glove and stalking appearance in upper limbs. And over here we can see intensely lichenified lesions with hyperpigmentation and sharp demarcation in this from the healthy skin, and all of these regions are lesions are distributed in the sun-exposed regions. We can also have vesicles and bullae, which can undergo suppuration, and later it can all heal, and even after healing they can leave hyperpigmented patchy marks. Over here we have a typical lichenified lesion in glove and stalking pattern. Because of the intense lichenification, it is also known as gauntlet of Pellagra. This is what a gauntlet basically is. To diagnose, it's basically a clinical diagnosis with a rapid clinical response when niacin is supplemented. But for research purposes, and decrease in concentration of urinary niacin metabolites can aid in diagnosis. For management, if there is no issue with intestinal absorption, a 50 to 300 milligrams of oral niacin can be supplemented. But if the absorption is affected, if there is associated malabsorption, parenteral 100 milligrams of IV of niacin should be given. In case of Hartnup disease, up to 100 milligrams of niacin is given daily, orally, or tryptophan ethyl ester, which is a lipid-soluble form of tryptophan which can be easily absorbed from the intestine despite the problematic transporter protein. This can get absorbed. Either this or this has to be supplemented in diet. Then the patients should be encouraged to avoid sun exposure during the active phase of dermatitis. They should use sunscreens and cover up the skin lesions with emollients or moisturizers. Along with this, the diet should be fortified. So that is it about niacin.